Helen Farabee Centers is the local intellectual developmental disability authority. I will be touching on the services provided by this LIDDA, including intake and eligibility, general revenue, community first choice, community placement, ICF or SSLC, crisis or NF diversions, IDD, crisis intervention services, and the crisis respite unit. Helen Farabee Centers serves a 19-county service area. The local authority is the first contact for all community placement referrals, intake, and determinations of eligibility. The clerical staff registers an individual and assigns and schedules an intake coordinator. The intake coordinator then meets face-to-face with the individual to review long-term services and supports, add to any local or statewide interest lists, as well as reviews the current situation to determine if immediate placement is desired or if a crisis is occurring. The intake coordinator will proceed with requesting records from schools and medical facilities in an attempt to gather all prior testing and any physician attestation of diagnoses. After the records are obtained, the intake coordinator turns all of the files over to the psychology team so that they can move forward with the determination of intellectual disability, or DID, report. A DID is a report that is compiled to determine eligibility for services and supports. A certified authorized provider gathers the records together and puts them in a report with any new testing that was performed and details which services and supports the individual is eligible for. To be eligible for IDD services and supports, an individual must have a diagnosis of an intellectual disability which manifested prior to age 18 as confirmed by their IQ measure and a determination of the person's adaptive behavior level, or ABL, have a diagnosis of autism spectrum disorder made by an MD or a DO, have a developmental disability or related condition on the approved list from the Health and Human Services Commission signed by an MD or a DO which manifested prior to age 22 with a confirmation of impairment of general intellectual functioning or adaptive behavior like that of an individual with an intellectual disability, be a nursing facility resident who is eligible for specialized services for an intellectual disability or related condition, or be eligible for early childhood intervention or ECI services. The General Revenue Program within Helen Farabee Centers offers two services: Respite, which provides caregiver relief for individuals who live in the same residence as their caregivers to provide in-home short-term relief, and Service Coordination, which offers assistance in accessing medical, social, educational, and other services and supports to help the individual. Community First Choice, or CFC services, allow states to provide home and community-based attendant services to individuals who are eligible for Medicaid, need help with daily living services, such as dressing, bathing, or eating, and need an institutional level of care. These services help with activities of daily living through hands-on assistance, supervision, or cueing, and to help the individual learn how to care for themselves. For individuals under the age of 21 who are on a qualifying Medicaid program and are eligible for Community First Choice services, as determined by the level of care assessment completed by the LIDDA, the managed care organization will help identify and assess needs and complete an individual service plan. If an individual does not meet the level of care criteria for Community First Choice Star Kids and the family is still interested in personal care services, they can contact the TMHP client line for potential enrollment through the Department of State Health Services. Community-based intermediate care facilities provide 24-hour awake staff residential services to individuals with intellectual or developmental disabilities. The individuals within ICF group homes have access to comprehensive and individualized services and supports in their local communities. There is no waiting list or interest list for ICFs. However, the facility owner-operator can determine additional admission criteria and maintain their own interest list based on occupancy rates. Providers can decline to serve individuals at any time, the primary reason for doing so typically based on age, gender limitations, and high medical or behavioral needs. State-supported living centers, or SSLCs, are residential facilities in which the staff is focused on providing residential services to individuals with severe or profound intellectual disabilities, or those with intellectual disabilities with high medical or behavioral needs. These are the most restrictive placements and must be a court commitment by a judge justifying placement under one of four types of admissions. Unlike ICFs, which can accept individuals with only a related condition, state law restricts admission to an SSLC to individuals with an intellectual disability. An individual with an intellectual or developmental disability may be eligible to request nursing facility diversion if they are at imminent risk to a nursing facility or at risk of long-term stay at a nursing facility. All of these requests are completed by the LIDDA and must be authorized by HHSC. Texas Health and Human Services may make a targeted HCS crisis diversion vacancy available to an individual with an intellectual disability who is determined to be at risk of imminent institutionalization or risk of institutionalization in state-supported living center, or when leaving a state hospital that is listed in the HCS Medicaid waiver application. IDD crisis intervention services provided by the Crisis Intervention Specialist, or CIS, include providing information to individuals with IDD, their families, and providers in the local area, and together with the service planning team, identifying prevention strategies, promoting coping skills, and training and supports, and also assisting with identified issues and concerns as identified by service coordinators during follow-up and monitoring activities. The Crisis Intervention Specialist also provides therapeutic supports to help strengthen areas of socialization, self-advocacy, and rights, developing coping skills, and reducing and avoiding stressors. The Crisis Respite Unit, or CRU, is available for individuals aged 18 years and older and offers 24-hour care for up to a 14-day stay in an environment that is less restrictive than a hospital, providing a short-term enhanced crisis delivery system. There are 2 designated IDD beds at the Crisis Respite Unit. Therapeutic supports are provided to individuals at the CRU during the duration of their stay and for up to 90 days post-discharge. The supports help to train individuals and their families to implement strategies for managing behaviors so that they can remain in a community environment. The CRU also acts as an out-of-home respite for either planned or emergency relief for the caregiver of a person with IDD, so that it can be used as short-term placement to avoid caregiver exhaustion or when the caregiver is temporarily unavailable. This is a list of different contacts related to the services that were touched on in this presentation. Thank you so much for your time. If there are any questions, please let me know.